While we're getting organized here, I have one question I would like to ask, take my prerogative here. It seems like there were a lot of themes that were raised by various speakers regarding data quality. You know, if you could make a wish list of things, the kinds of data that we don't have but need, what would it include?
I think we need to invest more in dietary assessment methods. You know, I think now I think that's really a holdback. It's really hard, not only with young children, but you know, think about what you ate yesterday. It's really, even though they've really tried to refine for diet recall, which I think is still the best method other than food frequencies. It all relies on self-report, and I know that Karen, maybe you can at some point talk about, you were talking this morning about some of the work that's being done at Baylor with other methods to really look at working with engineers and people in nutrition to really, you know, try to get some better methods. I know other people are working on that with, you know, with phones and then taking pictures, but I think we do need better methods of diet assessment.
Yeah, I'd like to totally agree with that. And at the same time, I mean, the work that we've done, for example, with young children and just observing what they consume in after-school settings or in lunch settings, I want to see more observations, making use of pictures and video, and it could be within home settings too, just to really gather more precise estimates to validate all the recall methods, which is kind of, I think, with the same thing you were saying, which I think would be very helpful.
I think it's easier actually for people to remember what they drink, and the size, rather than, you know, when they're reaching their hand into a bag of potato chips, how much they had. But it could help.
So I don't worry very much about the precision of how much these kids. I think it doesn't matter which data set we're looking at, we're seeing similar trends. But what we don't know, we don't have any longitudinal data on children. And so we don't understand, A, how the consumption of these different types of beverages could lead to body weight changes over time in this young age group. We also don't know how it tracks. All the data we've talked about today is cross-sectional data. And right now in the United States, there exists no longitudinal data on children from birth. And that's a big gap. Other countries have it. You know, we need to exploit those, but then we're different to some degree because, to be honest, what's in our food supply is very different from some other countries. And so that's a major gap.
Mary, when it comes to beverage data, you mentioned that people remember what they drink better than some things, but I wonder if that's more applicable when they're drinking packaged beverages. And we know that most Americans do drink a lot of packaged beverages, but just to think about the difference between collecting information on packaged beverage and water coming out of the tap.
The water out of the tap, definitely. Otherwise, if you can ask people what size, you know, cup they're drinking or whatever, but
yeah,
out of a tap, that's going to be hard unless you put a little
meter, flow meter, yeah. And of course, it's obvious if I say we need more information on the quality of that water coming out of the tap.
Thanks. Got lots of other questions I need to get to here. One for Christina. Can you provide a background on how some states have been able to pass regulations on water testing in childcare centers and schools? Maybe what facilitated the passing of these regulations?
I think that typically it's thanks to the work of advocates. And no, I don't know too much about the background of what happened in any given state. I know in California it was thanks to the work of a very strong network of drinking water advocates who work on all sorts of drinking water issues. In New York State, it was a group of advocates who developed what they called a 5-point plan for drinking water safety and then helped it develop into legislation. Last year, federally, 39 bills were offered for some kind of testing at the tap, primarily in schools. So this is obviously on the mind of legislators. But no, unfortunately, I whoever asked that question, let's talk later. Maybe we can find out more about that.
Leanne, I just wanted to bring a comment, though, in reference to the graphs that you showed us, because your source was what was reported in the media. So that basically tells us that we don't really know what the, how many schools or how many water supply systems are above that 15 parts per billion. And so, in fact, that's a huge underestimate. And until we get some kind of mandatory testing, we will not really get a good handle on these estimates.
So that's why the New York figures are maybe some of our best. It's mandatory testing. They've completed it in almost all schools in the state. By the way, it created a huge backlog in their water testing facilities. And as you saw, about 12% of taps show over EPA 15. Now, many would argue that the action level of 15 is way too high, and it is. But on the other hand, if we could bring all the taps that are over 15 down to 15, that would be a step ahead. So as I mentioned, this is a complex area.
Just a related issue is states have allocated some dollars for testing, but I see very little dollars allocated for remediation.
California is a little different in that, because when we developed our testing initiative, we also put money in the budget for remediation. But even so, it's really a battle to get schools, never mind childcare locations, to want to test, because they're very afraid of what they'll find. And we have to keep saying, but this is going into children's mouths.
Another question. This is, I think, is for several of you, perhaps. Mean intakes obscure the impact on high, heavy user consumers. For juice and SSB intake by children, 12 to 24 months, what does intake look like for the top 20%? Nobody knows. Mary, could you look at that in the Feeding Infants and Toddlers
Yes, we
data?
could. Right now, RTI International is doing all the analysis,
Okay.
and so I submitted a long list, and they're trying to do
Okay.
the
They're working their way through it.
yeah.
All right.
Just to bring a point, once again, it's all about our estimates. And so when you start thinking about the number of kids, like if we use NHANES data, and we think about the number of kids in each of those age groups, and then you're trying to think of the top 20%, you're going to get really unreliable estimates. So once again, it calls to the fact that we just don't collect enough information on children in this age group.
Steve?
And once you are looking at that, those with greater intake, the measurement error gets larger too. Yeah.
For a little change of pace here, this one is, are there culturally tailored interventions to decrease SSB intake in racial ethnic groups or in rural communities that have been successful? Might be some later sessions where
Yeah,
we
I
would,
think that some of the speakers will address that.
have some people who could answer that. Anybody want to respond?
Well, one thing that I would bring up is focus group work that Anisha Patel has done is showing that parents respond much better to electronic promotion and electronic messaging than written, which makes total sense, I think, when you think about it and think about where we are these days. So in terms of culturally appropriate techniques, I just want to put that on the table.
One of the challenges is always how to reach those people effectively, and they don't have much time. And
Yeah, exactly. So parents in the focus groups indicated that rather than something they need to read or a meeting they need to go to, something that's on their phone or short videos, whatever, would work better for them.
And so I think we know, based on just health intervention studies, that you need to tailor it to the culture and the specific individuals that you're looking at. So I don't know the results, but I know I've reviewed plenty of grants who actually have proposed to do just that, based on the population that they're working with, they have developed these very tailored interventions that really speak to, A, the source of the problem. Is it water insecurity, or is it the fact that they're consuming too much fruit-flavored drinks? And so they're working with both the messaging as well as what is the potential source of the problem. Once again, I don't know about the outcomes because just a reviewer.
There's a number of questions here that are kind of related with respect to 100% juice intake. So let me read a couple of these. Research shows that children who drink 100% juice is associated with higher intakes of whole fruit. Have you looked at how reducing 100% fruit juice might affect total fruit intake in this population? Another one says, did you look at the nutrients 100% fruit juice provides? How would removing or replacing 100% fruit juice affect nutrients?
So what we do know is 100% fruit juice does provide us with, with vitamin C. It doesn't provide us with the fiber and some of the other, nutrients that we can find in the whole fruit. And so in this very young age group, what we tend to see is that if they're consuming above the AAP recommendation of 4 to 6 ounces per day, that they're less likely actually to have room to consume the fresh fruits and vegetables. So I don't necessarily see that by reducing one, as long as, you maintain what the AAP guidelines are saying, that you're actually going to reduce whole fruit consumption, which is what us as nutritionists have been trying to push more, so that you get more fiber and the other nutrients also along with that.
Okay. Steve?
A small apple costs the same as about a juice, apple juice. That's a nice replacement.
Children of this age do not make the initial decision to try an SSB. So what are the tactics to target older sibs, caregivers, gatekeepers, parents?
All of them. But I was thinking, I have a 2-year-old granddaughter, and when I was visiting them a few months ago, I said to my son, she doesn't need that juice. And he said, well, I was raised on juice. And so what's wrong with that? And I remembered thinking that when, he's in his early 30s, that all of a sudden realizing that even in car seats and in strollers, they had little boxes and holders, which they never did when I was, before that. And so then I remember going to the state fair and seeing all these kids with a little juice. Back then it was juicy juice and the 100% juice, but and so I was saying, no, they only need, she only needs 4 ounces a day. And he really had, even though his mother's a nutritionist, did not have, was thinking this is really healthy and this is what I had when I was growing up. So I think we have to re-educate and kind of really increase the knowledge about the limiting the consumption of juice. And I think Steve is going to be talking about the AAP guidelines later on. And I think when I was working on the Rosebud Reservation and Pine Ridge reservations, you'd go in and you'd see these big gallon jugs of, all it was sugar water. I don't think they even added any vitamins to it. And it was like 99 cents, or sometimes you could buy them for 59 cents. It's, cheaper than milk. At that point, it was cheaper than water. And then they have little pictures, of the fruit on them. So I think it's really misleading. So I think getting the message out that these fruit-flavored drinks don't have any, many times don't even have any fruit in them, or minimal amounts.
Steve?
Yeah, just following up on that, I think the sugary beverage excise tax battles that have happened throughout the United States have really helped educate a lot of consumers about what sugar-sweetened beverages are. And I think it's been really important. And if you raise the price of some of these by 20–25%, it does really reduce consumption among all age groups. And I think, and raises for this conversation that takes place. And I think it's been a real positive thing. It's really helped a lot of folks. I know when I was coaching basketball in Little League when my twin sons were young, it used to drive me nuts with parents running in with all these sports drinks that they thought their kids needed because they were playing a Little League baseball game. And we kept on refusing them. Sports drinks, fruit drinks, it's confusing to most parents. And all the conversations around the excise taxes, I think, have really helped point out that this is just sugar and water. In the case of sports drinks, it's sugar and water and a little salt. No, your kid doesn't need it to play baseball. But it's a really difficult topic to educate on. But it, I think, has really helped.
Well, I think one other point is that I think quite often parents of young children use sweet drinks to manage kids' behavior. It makes kids happy. If they're distressed, it may help deal with their distress, whether or not they're hungry. And I think often parents need other strategies and tactics for addressing some of those kinds of issues.
Yeah, I was going to say, as parents, we want our children to be happy, and it's an easy way to make them happy.
It definitely is, yeah. Anna Maria?
And going back to Mary's original response, which is saying that we need to target everybody who's taking care of the child is true. And there's several papers out there that show the correlation between the gatekeeper, which is usually the mother, her dietary habits, and then what the children are eating. And they're highly correlated. So that if you have a mom that's more likely to eat fresh fruits and vegetables, the child is more likely to eat fresh fruits and vegetables. If the mom is consuming sugar-sweetened beverages, you actually see a higher consumption in the kids. So there are studies that actually show and demonstrate the fact that the caregiver is a very important role model.
There's a question here about dairy. What is the role of dairy in child care settings in schools? Does it compete with water? Anybody?
Well, this is always a concern, and as I mentioned, my boss, Lorene Ritchie, did a small study on that competition in childcare settings and found that there was no displacement of milk or healthy foods by water intake. But I think that we do need a definitive study on that. It's a fear, it's a confusion in the National School Lunch Program in terms of the guidance. Where is water allowed to be in the lunch line, in the cafeteria, whatever. Schools aren't really clear on that. And yeah.
Mm-hmm. Okay. Yeah.
And just, I think dairy has a place in the diet. It's a very important source of calcium and other nutrients. And, you know, if you look at just National Nutrition Monitoring data, the NHANES data over time, you actually see a decrease in dairy and specifically milk among children. Mm-hmm. So it's not necessarily that water is replacing milk. Milk has gone down in terms of our emphasis and what kids are being told to consume. So there's room for improving the messages in terms of making sure our kids are getting adequate dairy products in order to get those nutrients that they actually need from that particular food group.
Here's another one. Are non-Hispanic blacks being exposed to SSBs at home or in the child care setting? I think this may be a response to the levels being high. Yeah.
You know, we haven't been able to look at that yet, but I think some of the data shows it's really the much more of the home environment.
I think just the other related issue is if you're talking about a low-income population in early care and education settings, you're much more likely to see sugar-sweetened beverages in family-based daycare, which are more common. right, like versus daycare centers. And so in that sense, it would tend to be more prevalent in lower income populations. And we've studied that a bit.
This is for Anna Maria, but I think some of the others of you might want to chime in. Do you think fruit juice is a gateway drug for sugar-sweetened beverages?
Why do you think I'm the one who's supposed to answer that question?
That was my addition there. Is that really the gateway to sugar-sweetened
I think that's
beverages?
based on what you showed us, that if sweets are sort of like, an opioid, and the fact that kids won't reject it, fruit juice is one of the first, complementary foods being offered to kids outside of formula and, breast milk. And so, in fact, it's easy acceptance, and so you're just substituting one for the other. But I'm not an expert on that.
I think there is one longitudinal study, that was Kendra and Somerville's study, indicating that early juice consumption does predict later sugar-sweetened beverage consumption.
Yeah, I think that came out about a year ago. And most kids are not just drinking orange juice, which it tends to be not as sweet as something like apple juice or grape juice, which, oftentimes are very sweet.
Here's one for Steve. The estimate that offering water in childcare centers would result in $1,000 savings, is that per child?
No, that's
Percent.
a center with 30 kids. Yeah.
Yeah.
Yeah, there'll be a lot of juice.
I wanted to bring up an interesting little piece of that, though. I spoke to a person who runs a big childcare conglomerate in Philadelphia, and he said that when they tried to make the switch to less juice and more water, the parents felt that maybe they were getting gypped. Like, yeah. So I think a piece of that strategy is to make it clear that the money is being spent on something else that's good for the children, not just thinking that, they're taking away the juice.
Yeah, that's a very good point. We've heard similar things in settings around Boston, and that means you really have to frame it and explain it to the parents and talk about it, and then I think it can be fine, yeah.
I mean, one of the things I was hoping that we would bring up based on the estimates that you shared with, in terms of if you tax sugar-sweetened beverages, and the fact that some of our school systems and childcare centers are apprehensive about testing their water because of what they find, seems like you have a wonderful win-win situation where you could, allocate some of that money to a fund that would actually allow then school systems or childcare settings who need to do some kind of remediation would then be able to request funds for it. I mean, there's so many creative things that we could then do with combining some of these strategies like you had suggested, Steve.
Completely agreed, but I think a problem with that is that the taxes are city level, and I think we saw something recently that they're typically Democratic cities. So this would be a real equity issue.
Speaking of framing things, here's one that says how to frame limiting juice, even 100% juice, to the public, parents, caregivers, and providers. Back to your concerns about people being gypped. But what communication and messaging can be used? There may be some more discussion of this topic in later sessions.
Well, there's been lots of, I think Steve's going to bring this up when he starts talking about the AAP guidelines. And so physicians, it's one of the things that I have to say that medical students are aware of the fact that, when they're, getting information on what to tell parents, they are being taught about the AAP guidelines. And so I think that is sort of there. The question is, are they remembering to have that conversation? And is the parents then being able to translate what 4 to 6 ounces is into a meaningful sort of, okay, the sippy cup is about 4 to 6 ounces. So, and there's been some work done by, in fact, Eliana Perrin, and Alice Ammerman at UNC, where I came from, showing physicians portion sizes so that you would have more of the pictures to be able to educate the parent. That's really the key right now, is portion sizes. Everybody talks about the 4 to 6 ounces. They know they're supposed to limit it. The question is, how do you translate that into a meaningful diagram so that parents have that understanding? And then the second thing is, we have to realize that for this age group, it's not just the parent who's taking care of the child, it's the parent, it's the grandparent, it's babysitters, the child's going to daycares. So there's multiple places, and the question is, are they getting 4 to 6 ounces by each one of them, or just one? And so maybe that's where we actually probably need to place a little bit more emphasis on.
I agree that aligning those messages from the various messengers is really key. I think that we need to find some innovative ways to get this information out there, though, because pediatricians have so many things they need to tell parents about, and issues of beverage selection and portion size have to be way lower than immunizing and you name it. So that's why I brought up, for example, the WIC counseling, and of course WIC education in general, SNAP Ed, et cetera, and the oral health providers, assuming, well, we can't assume that most children receive adequate oral health care in the early years, but we need to find as many ways as we can to do that education.
Relevant to that, have any of the speakers looked at consumption rates among children enrolled in SNAP or WIC? Have you seen differences in consumption rates for children in those programs versus children who are not enrolled?
There are some studies that have been published since the change in the WIC food package that basically show the decreased consumption of fruit juice now among WIC kids. So there are some studies out there.
I would assume, Mary, there might be something you could look at. Not you,
Fruit
but
juice
it could be
consumption
looked at.
has decreased overall, but I think in FITS they also oversampled WIC, so they could look at that.
Among young children, SSB consumption is mostly based on juice drinks, but SSB taxes do not include these beverages. Should they? How feasible would that be? What kind of pushback do you anticipate?
Right, they do include all those drinks, yes.
They do?
I mean, all the cities
Great.
and counties we've talked about, yep.
One thing I think maybe it'll be talked about later is that in some countries, they're to really drive reformulation. It's not just a tax. Right now, you could have 10% added sugar, and you'd be taxed the same amount as a drink with 40%. So you could then use reformulation if you had a tax based on percent sugar to really drive it down.
Right, we've actually looked at that, what a tiered tax like the American Heart Association has talked about, where there are these 3 tiers, and it really operates pretty much like the tax is already operative, in the sense that most of the full sugar drinks out there fall in a narrow range up top, and then down below you have some fruit drinks and sports drinks that have a lower level of sugar, but most of the consumption now is just of the high sugar drinks. But I like the idea as an incentive to lower the amount of sugar. But if you look at what we're consuming right now, it's, as you started out pointing out, we love sugar, and we go for these high sugar drinks. That's what people are buying mostly.
Here's another question for Steve. In your estimates of cost savings in the childcare setting, is it assumed that juice is replaced by water? ECEs often use juice to meet the fruit requirement, correct? Do you have estimates for replacing juice with whole fruit?
Yeah, that's a really interesting question. Well, the estimates I gave for, let's say, the knapsack intervention really didn't make any assumptions about replacing juice with water. It was just the typical implementation of knapsack, of how it would affect actually BMI in kids, which you assume part of that will be through improved nutrition. I just used the example of how you could save money by eliminating juice and replacing with water. I think the issue around the way the regs are set up around what's a fruit and if a fruit juice can count as a fruit are more complicated, and I probably don't want to get into that now, but we're into whole fruits versus fruit juice as the way to go. But I'd be happy to talk about that outside this session.
Another question here. Is there a proposed mechanism for why children at higher BMI levels are less responsive to drinking water cues? I think that might be for you, Steve.
I think I was talking about less responsive to reductions in sugary beverages. It's they really have to do with the compensation mechanisms. You can read the paper by Catan and Hall, and they talk about the likely mechanisms. But if you think about someone as being really lean, and all of a sudden you cut their calories, they'll just get more hungry and search for sources of calories. Where if a person has excess body weight, where they may not have that same hunger mechanism, it may be something as simple as that. But read the Catan paper. It's actually really interesting.
Are there any correlations between mothers with gestational diabetes and SSB intake in children?
I'm not familiar with any that have looked at, women who had gestational diabetes and selectively looked at their dietary intakes to see then how they correlate with their kids. Because I don't think it's just the fact that they've had gestational diabetes, but it might be the whole dietary pattern of those particular women. But I haven't seen anybody really sort of carve that piece out.
I think I'm at the end of all the questions I have. Does anybody have a burning one they want to ask?
So
Yes.
I really appreciate the fact that you have presented some of the data by the education group. I think
Hang on.
it would be wonderful.
There we go.
I really appreciate the fact that some of the EPI data was broken down by ethnic racial group. I think it would be wonderful if you could do some acculturation research to try to find out, among Asian or, Black communities, Hispanic communities, and so on, whether acculturation predicts or explains sugar-sweetened beverage consumption within those groups. And at the very least, you may have language preferences in your surveys.
And then Haynes. And then when I start breaking it down by Asia, there's just not going to be enough numbers at all. We won't have that. I'm not even sure if Fitz will.
Yeah, I think it's really an important issue with new immigrants and refugees because they're coming from countries where the water isn't safe, and I think that also I think ties into what you were saying, Christina, that would be an important population to really reach.
Thank you. Richard Black, just a quick comment on the taxes and the tiered tax you mentioned. I always make the argument that these so-called flat taxes are not. They're graduated taxes. Graduated on grams of liquid, milliliters, right? Why not make it graduated on grams of sugar? The numbers on the bottle in both cases, or the can, it's just a number you're taking off the package.
You mean grams of added sugar? That's
No,
what makes it
sugar.
complicated.
Sugar.
Yeah.
Grams of sugar, because in a juice, grams of sugar. And then it's just another number on the package. And that incentivizes even 1 gram or 2 gram reductions. When you think of the impact across a $1 billion brand, that's a lot of tax. And you get away from those big steps in the tiered approach where you need to drop by 10 grams or something like that to have an effect.
it's a really interesting idea, but it is a lot more complicated to implement. Well, maybe we can talk about it afterwards. We can, as we've talked with folks in different places. Yeah.
I think there was another question in the back someplace.
Quick one. Thanks for the panel. It was a great overview of a lot of different facets. It's obviously raised a lot of questions. One question I had about the data, and I think maybe it was Anna Maria, was it looked like consumption among Mexican American kids is maybe decreasing at a higher than some of the other segments. And I was wondering, Steve, based on a comment you made, that some of the debates on arguments about the SSB tax across the country, whether they've passed or failed, has raised awareness about needing to reduce SSB. And I'm just wondering if you have a theory as to why it's decreasing among Mexican American kids, and could it be because of the Mexico tax issue that really did certainly raise a lot of questions and got a lot of press in this country as well?
When did that tax start? Because these data,
Just a couple of years.
yeah, it's not the same time frame then, not yet. You might suspect that it might be even better if you look at more years of NHANES data, but that data stopped at 2012, so it hadn't been in effect yet. Well, so one theory I have is the fact that there are more Hispanics on the WIC program, and WIC has clearly been sending messages about decreased fruit consumption and eating more of a healthy dietary pattern based on the WIC food changes that were existing in that package. So I think it might be some of that. That would be my best bet in terms of the national numbers that we're seeing.
I think there's, yes.
Hi, I just had a comment, Mary, about the Central American immigration. Our group at George Washington is working on an intervention, early care centers and at home, looking at Central American. What we have found so far with the formative work is that they drink tap water in their home country, and the perception is that the water is actually dirty here in the United States and not over there. So something interesting.
With respect to SSBs not affecting so much children with lower BMIs as opposed to children with higher, would that perhaps be because the children with lower BMIs exercise more than the children that don't, so they're burning calories more?
We could look at the Catan study. They have those estimates in there, and that could be part of the difference, but I think what you've seen with adults is it's the same sort of relationship, and it also could be related to exercise, but I'm guessing it's more related to the body weight.
Well, I was going to say, I mean, based on what we know about physiology and thinking about fetal programming that occurs between mothers who are obese, or the fetal programming theory about maternal obesity and how it affects child obesity, what part of that theory speculates is the fact that these children in utero and then as they continue in life have a appetite regulation that has been sort of disrupted. And so in fact, they are less likely to be responsive to their body's hunger cues. And so I think that leads to part of it, that the leaner children have more of a functioning, the HPA axis, the hypothalamus axis, that allows them to have appetite regulation, so that if they're decreasing their calories by not consuming the sugar sweetened beverages, something else has got to go up because it's more regulated, more closely regulated. And we don't see that in higher children or higher BMI. So that's part of perhaps the explanation from a physiological standpoint.
There was, I think, another question.
Hi, Sheila Fleischecker, USDA Office of the Chief Scientist. Great panel this morning. We, I think, spent a lot of time talking about taxes and debating, grams and ounces and stuff like that. But I was curious because this panel hasn't talked much about added sugar labeling or warning labels, how that would be put in the context of improving data quality about the amount of added sugars in these types of beverages, and also in terms of promotion to parents in terms of what's actually in their beverages.
I think it would be great, since added sugars are linked to things like subsequent mortality. It would be great to have that on the label.
Yes, and we need to really try to get FDA now to actually go ahead with the nutrition facts panel and having added sugars on it.
Right. I'm sorry. Hello, I'm Kari Cartwright from the University of Georgia. Mary, in the FIT study, it was alarming to see the rates of sugar-sweetened beverages among non-Hispanic blacks. Has there been any evidence to point toward why, particularly in that population, the consumption of sugar-sweetened beverages is so high? I know we talked about childcare settings and caregivers, but any theories or reasonings why and how we can combat that?
Yeah, we don't know that yet from FITS, but what do you think? I mean, because I think there's probably been studies done with, non-Hispanic blacks on why.
In my experience with Head Start and with a lot of the child care programs that I worked with in Georgia, particularly when I worked in Baltimore, the only thing that I thought about when I was looking at the data was sometimes when I would talk to parents, they would say, well, it goes back to making children happy. And so they would say, I can't afford certain things. I can't afford to take them to the park, but I can afford a juice box, or I can afford a soda. And it would make them happy. Now, I'm not certain that that's the core cause, but it was just really alarming because it was so much higher in the population. So I just wondered, had you seen anything?
Well, and I think there's data that Jennifer Harris will talk about later today that the targeted marketing is really, I think, driving a lot of this.
That's true. That's another factor. Thank you.
You bring up a very good point. There are data, actually, that when you look at infant feeding practices that show that Mexican Americans are more indulging of their children. So you do bring up this very interesting cultural perspective. And so if they are more indulging, they actually will allow their children. Am I right, Raphael? I mean, we saw that when we were looking at I know some of the information that you're going to present from the Robert Wood Johnson Foundation on what are these different important influences, once again, of why kids eat what they eat. And it is sort of parents' beliefs and practices. And so there are differences by culture.
Are non-Hispanic black kids of this age drinking less milk than other racial ethnic groups, Mary?
Yes.
So there could even be a trade-off going on there, that they're drinking more juice or more sweetened beverages because they're not drinking as much milk. Who knows? All right. I think we're going to take a break. And we need to be back